So our next presentation is from Laurie. She's going to be talking about the CINetwork moving forward from 2022 for the next 5 years. And she's presenting this on behalf of the network and Mike, myself, and Laurie, who are all co-strategic facilitators for the network. So I will stop sharing my screen, and Laurie, if you want to take it away.
Yeah.
In the meantime,
I'm the slowest one getting things up here because I'm multitasking. Sorry, guys. And
so in the, oh, there we go. Perfect.
Okay, thanks. Thanks, Linda. So just very briefly, it's always good to talk a little bit about the network and, you know, what is it? What have we accomplished? Where are we going? And some of you might be new, some of you have been around in a lot of these, but this network, it's the Manitoba HIV-STBBI Collective Impact Network. And our big goal is to tackle HIV and STBBI in Manitoba. We use a collective impact approach where we feel that bringing diverse stakeholders together and working on some common goals is really the way to go, because we're dealing with complexity. We're looking at systems change. The whole HIV and STBBIs are complex issues, and we can't do this alone. We have to work together, and we have to bring together different ideas, different ways of doing things, different minds, thoughts, etc. And we have to, this is the only way that we're going to make any sort of systems change. And what as we emergence is a big thing, that, and we've seen this already with the network, that by bringing different people together and having conversations, just as you've done already, these small groups, we see people's minds changing, and also that collaborations occur. And there's been a number of projects already that have come together that over this last 5-6 years that have really coalesced because of your relationships that you've been building. The way this network works, we have a central stewardship team, and we have some action areas. And then these action areas are around community innovation, truth and reconciliation, around addressing stigma and discrimination, looking at research and knowledge mobilization, and then prevention, testing, and linkage to care. And these are all sort of our action areas. These are what's working toward making systems change, and then ultimately the big impact. Could we really, in the future, eliminate HIV as a big impact, for instance? But all of us working together make this contribution. Some of our accomplishments over the last while in our truth and reconciliation area, there's a lot of projects that are going on. And there's a First Nations community readiness assessment workbook that's been developed. We've worked on ethical space and Indigenous research capacity building workshops. A big project on understanding system barriers for Northern First Nations people who have HIV. And then a new study on understanding the effects of COVID with Indigenous people. We've been doing quite a bit around stigma and discrimination, around understanding HIV, STBBI related issues facing gay, bisexual, queer, two-spirit, and other men who have sex with men, understanding HIV and STBBI related issues facing people who have migrated to Manitoba, completion of a stigma index study, understanding stigma through photo voice, and understanding the impact of COVID with gay, bisexual, queer, two-spirit, and other men who have sex with men. Doing quite a bit of work around testing, linkage, and prevention. There's been quite a bit of work on introducing different innovations in testing around dry blood spot testing, different INSTI self-testing methods, testing modalities, and then we've developed a Manitoba HIV-STBBI community event-based testing toolkit that, looking at bringing testing to events, for instance. And then community innovation is just hearing about, again, like this particular session today is hearing about all of the great community innovations that are occurring, and how can we harness those innovations and spread them as well. And what are people saying about the network? I love the network. It builds opportunity to move us forward. That's from a researcher, person with lived experience. We need the network. It helps us to have a voice. Policy person is the network helps us not to duplicate efforts. And from the community, the network brings together many efforts for a common goal, good synergy. So the good news is that we do have funding for the next 5 years. Yay, it's so exciting. We have funding for the whole network from Public Health Agency of Canada, the CAF fund, till 27. We also have funding from Reach Nexus, and then CIHR funds a lot of individual projects. We are continuing to have this systems change focus. And this is a model of systems change that we use. We'll probably be looking at this model because it's sort of like this V that's a little bit unstable. And we may end up kind of modifying this to our own way we want to do it. But this is an existing model of systems change. So when these presenters were asked about their presentations, if you take a look at the presentation package that's on our website, they've actually classified. Oh, go ahead.
Yeah, you have about a minute left.
Thank you. They've classified their presentations in this way. So take a look at that package. We're going to continue with a lot of the same areas in focus, but expanding in these areas. So stay tuned, and we'll be doing these kind of big events twice a year to continue, but other areas, as you can see. I do want to highlight here that we've got 2 usability studies going on, and we're looking for people to be part of those. So if you're an organization that wants to do the community event-based testing toolkit, let us know. And also the First Nation Community Readiness Assessment for Creating Change. We're looking for First Nations communities to test this out. And we're expanding. We now have funding, so we have a larger group of people that are going to be in our paid complement of people. So we'll be letting you know about who those people are, but a lot of them are here today, so it's very exciting. And get involved. Contact us to get involved in any of our studies. Join us at these network events. Present your projects. Let us know if you have a project you want to present on, even at our webinars, and stay in touch with the e-news. And that's it. I think we might have run out of time, right, Ken?
Yeah, pretty much. Yeah.
Okay.
Thank you very much, Laurie.
Thank you, Laurie.
That's exciting news. So
I will
definitely. I myself too. I'm looking forward to the next 5 years.
I was just gonna ask Mike if he just wanted to say a couple of words on it just before we go.
We'll give him a couple minutes.
Yeah, I don't want to be, we shouldn't be the ones that go over time while we're cutting everybody off, but just again to highlight the opportunity with those events. I'll talk about the HIV-STBBI testing toolkit. Really to know that whether you're a community organization or in a community, that would like to integrate testing into an existing event or initiate a new event that promotes awareness and testing, the opportunities to tap into that resource are pretty broad. So if there is any interest, or even you just need some help to strengthen an event that you already have in mind, definitely reach out, because it's a great opportunity to get a little bit of resource into communities where that resource has been in the past a barrier. So really give that some thought, and feel free to reach out, because we're really looking to partner. And if we have more partnership opportunities than we have money, there is a bit of an opportunity to go back to our funder and disclose that and see if we can wiggle out more. So don't be afraid to ask. That's it.
Thanks very much, Mike. Tremendous amount of work that these three are doing. So hopefully they can continue on and everything will stay sort of as good as it is now.